July 20th, 2014, a day that will always be remembered by Nigerians. It was a day that Liberian-American Patrick Sawyer flew into Lagos from Monrovia, the Liberian capital, via Togo, to attend an ECOWAS meeting. He collapsed at the airport and was rushed to the First Consultants Hospital, a private concern in the heart of Lagos, and one of those who cared for him was the lead consultant endocrinologist, Dr. Stella Adadevoh. It was a time when public hospitals were on strike. Officials at the hospital started to query viral hemorrhagic disease when the patient did not respond to standard anti-malarial treatment, and blood was spotted in his urine. By the 25th, it was known for certain that Nigeria was dealing with the Ebola virus disease, and hundreds of people who were suspected to have had contact with Mr. Sawyer were being traced.
All the passengers that the patient came in contact with have been traced and are now being investigated. In line with the World Health Organization international health regulations and in keeping with international best practice, all ports of entry to Nigeria, including airports, seaports, and land borders, have been placed on red alert.
The country moved into action and an isolation center was quickly created at the Infectious Diseases Hospital in Yaba, where all cases were moved. First Consultants was sealed off for decontamination. The media and state governments went on enlightenment campaigns. The people responded with heightened hygiene and calls to emergency Ebola hotlines. The World Health Organization, Centers for Disease Control, and other agencies also lent their support.
Nigeria had a very, very strong EOC, that's an emergency operations center, that coordinated everything, all the responses. So you see what happened was that immediately after we had our first case and all that, this EOC was set up and contact tracing was started immediately. And Nigeria is lucky because we have trained epidemiologists. The National Epidemiology, the FELTI, Field Epidemiology and Laboratory Program, is a CDC-sponsored program. So we had a lot of people that were already trained on field epidemiology.
By the last week in August, Lagos had started recording some improvement in the condition of some patients with supportive treatment of rehydration, blood transfusion, and temperature control. But the nation's containment efforts suffered a setback with the news of the death of a doctor who had treated a victim who escaped from the surveillance net and ran to Port Harcourt, the Rivers State capital. 5 days later, following a manhunt for him, he returned to Lagos, by which time he was found to be without symptoms. This case would have been of no further interest since he had completed the 21 days of surveillance without any other issue. But for the fact that the doctor who treated him in Port Harcourt died. That lone escapee, who eventually recovered, gave birth to a whole new set of contacts in Rivers State and another death. Nigeria had a total of 19 confirmed cases. The nation lost 7, but 12 recovered. Some of them were hosted by the Lagos State Governor, Babatunde Fashola.
We at First Consultant Medical Center took a risk. We sacrificed our lives because we knew that we wanted to ensure the safety of Lagosians, Nigerians, and humanity, because we're a global village. From a small village, it can spread to the world, and we knew the implication, but we said we would risk our lives. We would not let the index case leave the hospital.
The First Consultant Hospital counts its losses, but is proud of its part in the containment effort, as, despite pressure from senior diplomats at the Liberian Embassy for Mr. Sawyer's release, Dr. Adadevoh put her foot down to prevent what would have become a national catastrophe. Her case is now celebrated as the supreme prize for the nation.
The man was already here. If we let him out, within 24 hours of him being here, he already had contaminated and infected people. As we celebrate with the larger nation, the institution is grieving. we lost 4 of our pillars. The executive committee of this hospital was made up of 3 people. Myself as chair, Dr. Adadevo, and Dr. Abaniwo. Dr. Adadevo is gone now. Dr. Abaniwo is also gone. That leaves just me. And the 3 of us took the decision to stand by Dr. Adadevo and to make sure that the man did not leave this hospital.
Nigeria has now been declared free of the Ebola virus disease by the World Health Organization after observing 2 full incubation periods consisting of a total of 42 days without a new case of the disease. Mary Alale Yusuf, Channels Television News.